Can teething actually cause a rash? Let's talk. Hi everyone, my name is Whitney and I'm a dental hygienist here to talk about teething. So depending on who you ask, infants whose baby teeth are erupting can develop a wide variety of viral-like symptoms. Although there are still fairly controversial opinions on which ones are caused by teething or not, teething rash is one of them. And if you're the parent of a baby who is teething, you know just how hard it can be. So let's talk about the symptoms, how to prevent teething rash, how to treat it, and how to manage teething pain in general. First off, teething rash is when an infant shows some type of rash-like symptoms around their mouth, on their face, or elsewhere on their body. It is attributed to tooth eruption or at least closely linked to it, but of course, if the rash is across their body but not around their mouth, it likely isn't a teething rash. So double check to make sure the rash isn't anywhere else on the body, especially their torso, hands, or feet. It's more important to first rule out other types of viral infections than to assume that it's related to teething. So always work with your pediatrician to rule out other possible rashes such as hand, foot, and mouth, or scarlet fever, and then go from there. Once you find out that it's just teething rash, treatment is fairly straightforward, and we'll get to that in just a second. The usual teething symptoms, which in addition to the rash, can also include irritability, red, swollen gums, flushed cheeks, drooling and excess saliva, difficulty sleeping, general fussiness, decreased appetite, biting or sucking on fingers or hands, and ear rubbing. And these symptoms usually last for about 8 days. This includes about 4 days before the tooth erupts, the day it erupts, and then about 3 days afterward. This time frame is usually referred to as the teething period and can happen with each of the 20 baby teeth that your child will eventually get. And side note, it's a common belief that fevers go along with teething, but a fever has been found to not be related to teething, at least above 100.4 degrees Fahrenheit. A baby's temperature may go up a little more than normal when teething, but it shouldn't be an actual fever. I didn't know that until I started reading pediatric dental journals and articles, all that stuff to make this video. I didn't know that. All the sources are listed below. Nonetheless, since baby teeth tend to erupt in pairs, it's normal to have some extended symptoms of teething, rash or not, for longer than a week. And just another side note, tooth eruption begins around age 6 months and ends somewhere around the child's 2nd birthday. Now, how to treat teething rash? First, try to keep your baby's face dry. If there is constant saliva all over their mouth and face, they're going to be more likely to develop some type of skin irritation. Second, try putting socks or mittens over their hands. This will prevent them from scratching their face whenever they're grabbing at their mouth or ears out of discomfort. Also, always try to keep their clothes dry by changing their bib often. And finally, ask your pediatrician about which type of over-the-counter creams are safe to use on your baby's skin for a rash if needed. And how to prevent teething rash. So some babies aren't fussy at all when their teeth are cutting through their gums. Lots of babies will never get a teething rash, and some will not have many teething symptoms at all in general. But either way, there's not a lot you can do to prevent teething rash that's different from treating it. So like keeping your baby's mouth and face clean and dry after they eat. Be sure to clean around their mouth and lips. Those types of things might help. Also, be sure to clean anything that's going inside of your baby's mouth on a daily basis, such as teething rings, pacifiers, or other toys they like to chew on, as they may harbor bacteria and contribute to a worse rash. And lastly, how to manage teething pain. Most pediatric dentists and pediatricians will recommend giving your baby Tylenol or Motrin as directed to help manage obvious discomfort. Again, always talk with your individual physician about your baby's individual situation. Another great non-medication option for minimizing teething pain is to use a clean, cool, wet washcloth over your finger to gently rub their gums to temporarily ease irritation. Or you can give your baby something clean and cool to chew on. A refrigerated teething ring is a great example. I'll link some products that I usually recommend to my patients in the description box. And be sure to never dip teething rings in anything sweet, of course, because dipping them in flavor or sugar can cause cavities. In all, the jury is still out on how accurate teething-related side effects are in infants. But there are several studies connecting teething rash to baby teeth eruption patterns, and the good news is that usually the symptoms go away within about a week. The bad news is if you wait that long to see a doctor about illnesses like rashes, you run the risk of missing another illness. So always better to be safe than sorry. Always call your pediatrician if you see a rash, even if you're pretty sure it's from teething. Always best to confirm with a professional. I will link my other baby teeth videos in the description box if you'd like to learn more about eruption timelines, your baby's first dental visit, things like that. I hope this video helped you. Please like, subscribe, and turn on your notifications if it did. If you want even more teeth talk, you can visit my website, teethtalkgirl.com, and hang out with me on Instagram @teethtalkgirl. Peace, love, and teeth.